Dear audience, welcome to the second webinar of this year's RPS GlomCon Renal Pathology webinar series. I am Nicolas Kozakowski from the Medical University of Vienna in Austria, and on behalf of the Education and Training Committee of the RPS, I will moderate today's session. I am delighted to introduce today's speakers, Dr. Shreeram Akilesh.
Thank you very much, Nico, and thank you again to GlomCon and to the Renal Pathology Society, and especially to Dr. Mei Lin Bissonnette in Vancouver for the invitation to present today. And thank you all for joining on a Sunday. So as Nico mentioned, today I'm going to introduce the topic of spatial transcriptomics and talk about how it can be applied to study kidney disease. As a brief outline, I'm going to try to bring everyone up to speed to think about what do we mean by spatial transcriptomics in terms of understanding when we put a tissue section on a slide, how can we deeply interrogate that to understand the underlying biology, and then think about how that can be applied to study kidney disease. I will briefly discuss two widely used technology platforms that have kind of established themselves in this field. And the reason for this is you will be seeing publications that use one or the other platform. And it may be useful to understand how they work and what their blind spots might be. Then in the second half of the talk, we'll discuss some of our own studies that have used these technologies to try to understand glomerular diseases, such as collapsing glomerulopathy and minimal change disease. And finally, I'll provide some perspective on the state of this technology and how I think it's going to be applied moving forward. So by way of introduction, when we think about spatial analysis, we're really thinking about localizing, information in the tissue. And this really was spearheaded in the 1600s by Anton von Leeuwenhoek, shown here, and Galileo and other inventors who created microscopes to try to directly visualize and study the microscopic world. So on the left here, you can see an example of one of Leeuwenhoek's microscopes, which was this metal object with a little lens over here. You place the sample over here. You could focus it up and down and move it back and forth with these little screws. So even though this looks very crude, Leeuwenhoek's other major improvement was the use of a variety of special stains that would now enable him to visualize things that were microscopic and otherwise actually transparent and invisible to previous investigators like Galileo. And so this is kind of why he has been referred to as kind of the father of microscopy for really the special stain application to study the microbiological world. So even with this crude microscope, he was able to get a 500x or so magnification, which allowed him to describe all sorts of microscopic organisms and structures in plants and animals. So since that time, investigators and of course clinicians and pathologists have always been thinking about how can we extract more information out of a slice of tissue. So if you think about it, even if we were to take an organ such as the kidney and embed a portion of it into after fixation and create a thin section of it, there's a tremendous amount of information that is actually encoded in this piece of tissue, even in a single slice of it. And so since Leeuwenhoek's time, where he developed a few stains in about the 400 to 500 years since then, this was the state of pathologic and microscopic research. It was really to develop a whole variety of stains, which would label different cellular structures or potentially identify organisms and pull them out with respect to the background tissue architecture. Now, these have the advantage of being very cheap, reproducible, and they can be widely used in almost any laboratory in the world. But really, for about 400 or 500 years, this was the state of trying to extract more information from the tissue. However, another way to extract more information out of the tissue is to try to use a different microscope. And we use this routinely in kidney pathology. For example, we use electron microscopy, shown here at the upper left. This gives us a black and white image, but at very high magnification. So we can look at the ultrastructure of the kidney or other tissues and organelles and identify if there are changes, such as if we think about glomerular disease, we can ask, is there foot process effacement? Are there immune deposits, etc.? But there are many other types of microscopes that are being used more in the research setting than in a clinical setting. For example, you can focus an ion beam across a slice of tissue, vaporize the material, and then using mass spectrometry, identify the component parts. This has been used to study the lipid composition, the carbohydrate composition, protein composition of tissues. You can also use spectroscopic methods such as